Welcome to the Hit Like a Girl podcast. This is High Tea with Grace, where we spill the tea on HIT. I'm very excited to welcome Juli Stover from eVisit. Juli, thanks for joining us.
Thanks, Grace. I'm glad to be here.
So we're going to talk all things telehealth today. So tell me about eVisit and the role that you play there.
Yeah, well, it's my favorite topic, so I'm glad to do that. So I've been here with eVisit since the beginning of December, but I think what's really cool for me is I've been an official part of the team since December, but I actually was a customer of eVisit for a couple of years before that. So I feel very fortunate having sat, if you will, on the other side of the table and kind of gotten to see eVisit from both sides. And so I think it gives me a unique perspective on our business. I joined the team as the Chief Strategy Officer. And so I'm going to be leading a number of exciting new efforts, as well as being involved in our day-to-day core business as is. But lots of exciting things coming up for us. I would say high level, eVisit is a virtual care platform. And, honestly, we've started to take virtual out of the description altogether because we simply just believe this is care delivery now. This is healthcare, and this is where we are in the healthcare industry. And so, we've started to really use the term care delivery platform instead of virtual care. But I think just for the sake of explaining to folks, that's who we are and that's what we do. And we really enable our customers to deliver care in creative, more innovative ways than possibly they ever have before. And what we're seeing a lot of right now is even when maybe they have been doing virtual care let's just say pre-pandemic, they're really changing and reshaping the way that they're thinking about that. And quite frankly, they're doing that for the sake of their organizations and how that landscape has changed a little bit. But they're also doing it because their patients' expectations have changed as well.
Oh, absolutely. That's so true.
Yeah.
We saw COVID brought telehealth into the mainstream. And You're right. It's all just care from home. It's not virtual care anymore. This is how people are doing their care.
Right.
But we know that a lot of providers still underutilize the technology, kind of failing to apply it in ways that can, enhance their practices. Patients want this. So I'm interested, what do you think about the state of the industry right now?
Yeah, well, I think what you're seeing is kind of a little bit of what was happening when you remember when we all made kind of the big shift, if you will, to electronic records.
Yeah.
There was this resistance, there was this pushback, if you will, from providers who have kind of, this is the way I've always done it, right? And so for many providers, it's hard because the way they were trained and really probably the reason why they got into medicine altogether was that face-to-face interaction with a patient. So I'm certainly sympathetic to that. But I think, what we're seeing now is this evolution and this growing understanding and level of comfort with the fact that, this is a phenomenal way in many instances to deliver care, better and faster and more efficiently. And so, I think that's where we are. While there's still some hesitation, the game has certainly changed.
Absolutely. And what are ways you think that providers maybe could be leveraging telehealth to increase this efficiency and increase revenue now that reimbursement models are starting to align with the needs of patients and the needs of the industry?
Yeah, well, one of the biggest ways is, and you hear this so much right now, is provider burnout, clinician burnout, and not even just burnout, but just lack of resources in general. Providers leaving the industry at a faster rate than they ever have before. And so when you start to think about the role that technology can play, even beyond just the consult itself, it's what can you do to utilize and leverage technology on the front end of that encounter to make sure that, number one, a virtual visit is even feasible for what's going on with the patient. Does the patient need to come in and be seen in person? Do they need to actually just go on to the ER, or could they go to a completely different point of care? So I think when you start to think about those efficiencies, it's about, let's let's utilize the tech to do that front end screening to get them to the right place and kind of take a little bit of that burden off of that front end staff altogether to determine, does this patient even need to be in the office today? Or could we see them in a different manner or send them to a different location altogether?
Yeah, that is so true. That is, I mean, that makes so much sense from a parent perspective. I don't mind doing that for them to give me the correct appointment. I don't want to waste anyone's time. There's mine,
Yeah.
Are there any other ways you can see it really, being leveraged to increase this efficiency?
Yeah, I mean, you go into the hospital setting just as a great example. One of the things that I was doing with the technology with this platform prior to was participating in a national program, a CMS innovation initiative called ET3. And ET3 at its core is really trying to gain efficiencies within emergency medicine in general. And, I'm not sure if a lot of people know this, but EMS agencies actually are only reimbursed when they physically transport a patient to the ER. And, that all patients don't need to go to the ER, right? Some unfortunately don't have modes of transportation. So an ambulance might be their way to get there. Some still, again, don't know if that's where they need to be at all. And so they're calling 911, quite frankly, again, just to kind of get that triaging. So ET3 actually gives the paramedics the opportunity to get to the scene, make what CMS has termed as an appropriate determination of care. Does the patient need to go on to the emergency room? Okay, great. We're going to take them. Absolutely. But could they go to what CMS has called an alternative destination of care? Maybe that could be a FQHC, an urgent care, a primary care, mental health clinic, you name it. Or they are also offering what's called treat in place, which is where the virtual technology comes in. And so the paramedics right there on the scene notify a physician and say, hey, I've got a visit for you. And right there in the patient's home, office, wherever they might be, they connect with a physician and do the visit right there. So the efficiencies that are gained in this process altogether, not just from the physical in-person impact on that patient going to that facility unnecessarily, but just for the ambulance crews, that gets those trucks back in rotation faster. It saves them time. They're able to get reimbursed for still the effort and the work that they've put in. But in some instances, this is huge for counties and or areas that might only have a couple of ambulances available. It just, increases, again, the efficiency of that crew and it puts them back in rotation faster to address, more acute, emergent type situations and conditions. So there's so many ways that technology is starting to be used in more innovative and creative ways, just to improve upon the entire care delivery process.
That's incredible. I had never heard about that. And I'm sure a lot of folks that are on this channel are really interested in learning more about that. Is that on the CMS website? Do you have yes. Yeah. Oh, wow.
Yeah. Check it out on the CMS website and just, you can look up ET3. And again, it's referred to as a CMS innovation initiative.
Wow.
Yeah.
So now at HIMSS 22 in Orlando, I was there as well, and we heard the phrase digital front door ad nauseum. Now, in a recent article by Dave Lovecchio in Healthcare Business Today, he was talking about the buzzword bingo and how at HIMSS this year, you could have filled out every single card because these terms were all over. Do you like the term digital front door? What do you think about it? And why or why not?
I don't like the term digital front door, and I'll tell you why. Patients are not just coming in the front door of facilities. And so I think that it's necessary to explain the concept. Again, people resonate with the term from a conceptual standpoint, but really it's about the digital front door, the back door, the side door, the garage, whatever, heck, maybe even the chimney, I don't know. But the way that they're entering healthcare environments is so different and so varied. And so healthcare organizations, those are the types of things they're having to look at right now and take into consideration is, okay, patients are entering our system from this direction. What do we need to do to engage them again differently, more effectively, more efficiently, to get them to the right place, to get them to the right folks, to enable care for them? And so again, high level digital front door, I get it. It is everywhere. It's trendy. It's a hot topic, but it's really so much bigger than that. It's really so much bigger than just the front door, because how many times can you say you actually walked through the front door of a hospital? Not many. We got it from a lot of different angles. And so I think it's just about thinking about your engagement strategy as a whole, and where do we need to be meeting the patients?
Yeah. And at HIMSS 22, we were also kind of hearing about how healthcare organizations are shifting their focus from telehealth adoption to sustainability, now to really sustaining this adoption and making it a critical part of their organization and their financial framework, et cetera. So, what telehealth trends are you seeing today in that regards?
Yeah. Grace, what I love about this is that I hate the way it had to happen, of course, but if you've been in the telehealth space for more than 5 minutes, you have said every year of that time, this is the year, this is the year, this is the year for telehealth. And then here comes 2020, right? Who would have thought? And sure enough, it was the year where the game changed literally overnight. And so what happened with that, again, is a blessing and a curse, is all the regulations were relaxed. You can now, you can bill for all of these and receive reimbursement, these encounters. You can pretty much use any kind of technology that you want to use. And I jokingly said this, but it's really the truth. Everything to include, 2 tin cans strung together with string. I feel like that was even allowable, But the challenge with that is that, and I've said this forever, the technology really is, it's really the last thing that you should be making a decision on. And so while people during the pandemic, they had to, right? They had to make quick decisions out of necessity. It's just what was required. Mm-hmm. But now they're able to go back and look at those decisions and truly decide if those decisions they made at that point in time are meeting their needs. And in many instances, they're not. So when I say the technology is kind of the last thing that you should be thinking about, I would encourage folks, and I have, throughout my career, folks always come to you and they're like, oh, look at this really cool piece of technology, hardware, software, whatever, we want to use this. And unfortunately, what I've seen is folks spend a lot of money on technology that they have not, truly built out the strategy and the workflow prior to leveraging that technology in. And so it ends up not being effective after all. And so what we try to do is, we work with our customers to let's talk about the workflow today. Take technology out of the equation. How are you treating those patients today? What does that look like? Step by step by step. Who does what? When do they do it? Why do they do it? How do they do it? All those different steps. And then let's talk about, okay, where do you see technology coming into the equation to potentially change that? Where do you see the intersection of technology in this workflow? Okay, great. What does that look like? What is it that you're trying to improve upon? How are you going to measure success? And then go look for the technology that's going to enable exactly what you just mapped out. Because otherwise, you're going to get a year down the road and somebody's going to say, hey, was this program successful? And you're going to say, oh, yeah, absolutely. And they're going to say, really? Why? And you're not going to have anything to show for it. So I think that is the problem, is that because the technology is new and different, folks have a tendency to start with that. And it really should be one of the last decisions that you're making when you're launching types of programs.
That's really impactful, and is a huge shift from what the industry has been doing to date. And it's totally the way that people should be doing things. It makes so much sense when you say it that way. Yeah. Something else I've also heard you say is that healthcare providers should leverage digital and virtual tools to enable hybrid care delivery. So
Yes.
can you define hybrid and what that means? Because I think you're the one to answer this question for me. So yeah, let me know what you think.
Absolutely. Yeah, I'm not going to tell you that, that all care should be delivered, via virtual platforms. Absolutely not. I would never advocate for that. I think that there is a very natural, beautiful blend of the two. Again, there are just folks that need to be seen in person. I think that is absolutely going to always be the case, whether that's in a hospital, whether that's in a clinic, wherever that happens to be. But there is a very large number of issues, if you will, that can be addressed via virtual. And quite frankly, some of them are probably better suited for virtual. There's a lot of counseling. There's a lot of, clinical and medical training and education that can be done. There's a lot of benefits to being able to utilize technology. And I'll give you just a couple of other quick examples to do that. But I would say hybrid is, again, truly evaluating the patient's condition and determining what is that balance of inpatient versus virtual care that can be delivered to drive the best possible outcomes for that patient from a quality perspective, from overall care. And, we hear a lot about, you hear that, again, another, trendy term, population health, which is great. I get it. But what population health means is so varied and so different for so many people. And so let's just take folks with chronic care conditions as an example. They're always going to need to be seen in person once, probably twice a year, maybe more often, depending on what's going on with them. But utilizing virtual in between those in-person visits just really enhances the overall care delivery. Because as a patient, I'm not saying anyone would do this, but I'm just saying as a patient, via text, via phone, via email, I can tell you whatever I want to tell you about how my condition is and how I'm doing, how I'm progressing. But when you physically have the opportunity to look at me and to see me and to carry on a conversation with me, then you have the opportunity to evaluate me yourself and make those actual determinations. And so I think as we start to look at, chronic conditions, again, are a great example. And just that overall care and how we can improve upon that, if we can just put our eyes on a patient, more often, then it's just going to improve the overall system in general. But I think that, again, we've got to get to a place where reimbursement meets that world. And unfortunately, in all instances, it's still not there today.
Yeah, it seems like it's a very strategic dance to improve care at home and improve care in the office and make sure that the doctor and the patient are having relationship and it's being improved in the in-between, like you said. But those reimbursement models are not recognizing that dance, and they need to do the Charleston or something. They got to figure it out.
They do. They really do. Yeah, and I think it's really upon us, to advocate, to continue to advocate and really push this type of legislation, in order for value to really truly make the transition to value-based care. We need a lot more data. And so I think, data is going to tell the story, and we can't continue to be anecdotal in our descriptions of the impact. And so I think that it's upon us to continue to advocate and push legislators around these policies, but it's also upon us to build these models, collect the data, tell the story more effectively than we ever have before, and just truly validate, why this is the way care is and going to be, delivered in the future.
That's very powerful and is so true. Now, our listeners love to hear about the industry, but they also love to hear about you personally and your personal journey. So I wanted to start with on this side of the conversation. What's your favorite leadership book? You're a chief strategy officer, you are strategic mind. Is there a particular book that you like or you've read that's inspired you that you'd like to encourage others to read as well?
Yeah, so I'm a reader. My peers make fun of me because I am typically probably reading about 5 books at the same time.
Wow, you are a reader.
I'm usually reading, some for pleasure, some for personal development, a mix of both. And so, kind of depending on my mood, I pick up whichever one fits that mood at the time. I'll tell you, I have a couple that are top of mind for me right now. There's so many great ones out there. One in particular that I recently read for the second time. And I said to myself when I read it the second time, I said, this is a book that I should read every year. Every year I should do it and remind myself. It's called Juggling Elephants. And it's a quick and easy read. I'm telling you, you can read it on a plane ride. It's a really quick, fast read, but it just resonates personally and professionally. But it's just about, prioritizing, and how if you're trying to do everything, then most all of those everythings suffer, and so it's really about prioritizing the most important things in your life so that they get the time and attention that they need, and just helping you feel more balanced. I think that's the first thing, I would say, is we all need to find that balance in every respect of our lives. And then the second one that I just recently read is called The Energy Bus. Again, it's a pretty quick read, but it's a fun read. And what I love about it is that you don't always have to be the most talented person on the team. You can bring the most energy and the most optimism and just that team attitude and that can-do spirit. And it's just so powerful. It's so powerful to every environment. And so that's a goal for me, is just that is positivity and just trying to find, the positive in every situation, and just be that energetic force, if you will, for my team, and that optimistic light. And so I love The Energy Bus because it kind of takes that perspective and really describes it in a very fun but effective and meaningful way. And they actually changed the acronym CEO, instead of being Chief Executive Officer, to Chief Energy Officer. And so we have a phenomenal CEO, official CEO at eVisit, but I'd like to think that sometimes I'm the CEO as well, just from an energy standpoint.
That is fantastic. I'm going to have to get both of those books and read them for sure, because obviously all women are working through that in their life and wanting to keep that positive perspective and juggle all the things. And so I really appreciate those recommendations.
Yeah, for sure.
So I'm also wondering, what makes you tick as the Chief Energy Officer? What makes you tick in your life? What gives you joy?
Well, I've prided myself on throughout my career of being able to say that I don't get out of bed every day and feel like I'm going to work. I love what I do. I'm passionate about it. I love the people that I work with, and what I really love about it is just, and I've said this for ever since I really officially kind of made the transition in the healthcare industry to the telehealth space in general, is I said, people don't typically access healthcare because they want to. They access healthcare because they have to or they need to. And because of that, they don't always have a positive outcome. It's not always for positive reasons. And so when I started getting involved in the telehealth space, what I realized is that any day that I had the opportunity to talk about telehealth and the impact that it could mean for patients, for the communities they live in, for the healthcare system in general, it was going to be a good day. And so that's where my passion was born. As I said, this is my way in healthcare of truly finding that positive aspect in it, where everybody wins, everybody who's part of the equation wins. So I would say professionally, that's what makes me tick, is that I continue to believe to this day, this has such an opportunity to have a positive impact on everyone that it touches in every regard. So that first. but I would say, above all else, my family, my husband, my kids, all of my friends and my loved ones, I find such great joy in them and their achievements and their successes. And so I love, being part of that. We have older children now, and so, young adults, if you will. And so watching them as they're growing and maturing and kind of setting into their careers is a really exciting time for me. We're empty nesters. And so we say that our animals are our kids now at home. So we love on our fur babies and enjoy them a lot. But yeah, we otherwise just enjoy traveling and doing fun things in this phase in our life. And so, yeah, so I would say all of those things make me tick.
That's fantastic. Now, the last question for today, tell us about the work that you're most proud of that you've worked on there at eVisit or in the past, or whatever work that you are most proud of to date.
Oh, wow. Yeah. I mean, so again, I would just go back to, I think that anytime you can involve a critical access facility as part of these equations in virtual health, it is a huge win. And so I'll tell you what, a little bit more about what I mean by that. So you hear every day about critical access facilities closing in this country, due to, typically reimbursement issues, things around that. And so what I have had the privilege to be involved in through the years is critical access facilities taking virtual health and changing their business models and seeing revenue in different ways that in many instances enable them to keep their doors open.
Wow.
So bringing services into their communities that they would never be able to deliver otherwise. And so, again, that's a huge win for the patients because they're now getting, care closer to home. But these facilities who are, in many instances, the only care delivery locations for folks for sometimes hours away. And I've had the opportunity to just bring those types of programs to some of the, most rural communities in this country. And I think when I see them take the technology and put it in place and not only enable their, the care to those patients, but probably keep their doors open. And those are employers, right? So those are folks' jobs and their livelihood. And so it's so much bigger. It has so much more of a bigger impact than, hey, we're just going to change the way we deliver care. No, you kept the doors open to that facility. People kept their jobs as a result of this. And then, oh, by the way, you probably saved lives too. And so, all of those things in and of themselves are huge. Together, it's just such a beautiful opportunity. And so, again, that's where my passion for this comes from, these rural communities. And oh, by the way, urban communities suffer too, right?
Oh, like yes.
there are issues in urban communities as well. But for me, when I see the news and I see, how many critical access facilities closed in a day, I think in my head, man, I wish I could have helped them, with a program like this. I wish I could have helped them put a program like this in place because we might have been able to change their story.
Yeah, that is so inspiring. Oh, I love this, Julie. That is terrific. Now, to finish off this conversation, right, where can our listeners find you online?
Oh, well, predominantly on LinkedIn. So I would say, please connect with me on LinkedIn. I love it. I love learning from, LinkedIn has again become kind of just this great source of training and education and knowledge sharing. And so I would say absolutely connect with me on LinkedIn. We have a phenomenal team also that's doing a lot of, blogs as well. So please check out the eVisit website and look for a lot of that content, not just from me, but from many of our other teammates. And so, yeah, I would love to connect and chat with any of them and hear their stories and just continue to grow and learn.
That's terrific. Now, before I forget, did you happen to bring tea with you today?
I did. I brought tea. Yes, I am also love houseplants. This is as a result of the pandemic. And so I, in addition to being the parent of my fur babies, am also a proud plant parent.
That's amazing. Do you happen to know how many plants you have?
Oh gosh, I don't know, but a lot. I would say, yeah, probably at least, oh God, probably at least 10 to 12 in several different rooms in the house.
I also love to garden outside,
Yeah.
but they do say there's so many health benefits to having plants and mental health, physical health, to working
Absolutely.
with the dirt and keeping the plants healthy. Have you found that to be
I
true?
have. I have. This started for me during the pandemic, and it has just grown from there. But yes, many health benefits. Of course, increased oxygen levels. Here we are stuck in our houses, right? So let's increase the oxygen, and so many benefits to that. But I would say that it is very therapeutic for me. And when I want something to do where I can just truly focus on that and not think about many other things, I do find that in caring for and taking care of the plants. So, and folks always say, they're like, oh no, I kill everything. I was pretty much a I kill everything person prior to this. So I have, found the ones that seem to like me the most, as well as me liking them. And I'm not gonna lie, I've killed a few through this time period, but I've really started to enjoy it a lot.
That is just too good. Thank you so much for sharing that with us. And thanks for joining us.
Absolutely. Thank you again.
And thank you, folks, for joining us too. Check out the Hit Like a Girl podcast website and YouTube page for more great guests like Juli today. Cheers.
Cheers.